Today on Riverside Strong, we'll be talking about colorectal cancer, one of the most easily detected and preventable forms of cancer, but sadly also the second leading cause of cancer death in men and women combined in the United States. We'll hear one patient's inspiring story, and we'll learn about options for screening and treatment from an outstanding Riverside care team of primary care providers, gastroenterologists, and a colorectal surgeon. All coming up on this episode of Riverside Strong.
Adversity, disasters, emergencies, crisis. These are not the things that create character. No, these are the times, the moments that reveal character. You know what it also reveals? Compassion, empathy, humor, creativity, innovation, kindness, perseverance, knowledge, and strength. Perhaps strength most of all. We are Riverside Strong.
Welcome to Riverside Strong, where we take a look at a vast array of medical issues from the points of view of both the patients and the medical professionals who treat them. I'm your host, Ashley Snyder. Today we are focusing on colorectal cancer, a disease that affects many adults, including an increasing number of younger adults. The good news is that this cancer can be largely prevented through early detection with screening beginning at age 45. The problem? In early stages, colorectal cancer may not produce any symptoms, and people find lots of reasons to put off screening. We'll talk about why early detection is so critical, what it involves, and what to expect.
We are Riverside Strong.
Welcome back to Riverside Strong. Today, we're going to hear from a patient who at age 60 had not been screened for colorectal cancer. She had no family history, signs, or symptoms, and life was busy, until she met a young friend who was diagnosed with stage 4 colorectal cancer. We'll talk about the importance of early detection and diagnosis, and why it's critical to begin screening at age 45, or even earlier if you have any personal risk factors.
My name is Barbara Klein. I live in Williamsburg. A retired school bus driver after 13 years in Williamsburg, James City County with the best children in town. I have 4 daughters ranging in age from 38 to 28. They're all 3 years apart. A pastor's wife at the same church for 24 years. A Mimi to 5 of the most amazing grandchildren, and soon to be 2 more, another set of twins that are due in June, so that makes 7, and the joys of my life. I got my first colonoscopy at age 60, which is really late in life, and I know that, and I don't recommend that. With my busy family, I had all the excuses for all the wrong reasons: pastor's wife, church activities, the school bus I didn't want to miss. You know, if I had to do the prep, it would have to be on a weekend, and I didn't want to mess up my Sundays, and so that was all my excuses. I met a friend at a Jeep event in Nags Head, and Jeepers, you know, we meet and greet, we share Jeep stories, we go to the beach, we love the beach. She was diagnosed in 2016, and it was now 2018, and she was diagnosed right away with stage 4 colon cancer. And I was just, you know, I wanted to spend time with her and find out, how are you dealing with this? And after hearing her story and spending time with her, I was just compelled, I've got to get this colonoscopy. So I made an appointment with my primary care physician, Dr. Ainsley, and I told her about that time they were showing the Cologuard commercials. So I thought, I can do that. You know, it won't take any time out of my day. It'll be private. I can just let them send it to me, and I'll do that and be done.
Mrs. Klein came in for her yearly wellness appointment, And part of that is we go through all the different screenings that the patient is ready to have. And one of those is she had not had a colonoscopy at that point. She had no family history of colon cancer, and she was also completely asymptomatic. So we were talking about it as a screening mechanism to make sure that she didn't have anything underlying. She hesitated a little bit and she wanted to know about different options instead of going right to a colonoscopy. So I told her that the colonoscopy was the gold standard and still is the gold standard for colon cancer screening. But if she was hesitant about that, we could do something different like a stool DNA test instead, with the thought that if that's positive, then we would send her to gastroenterology and she would have to have a colonoscopy. Then we talked about the various stool tests that exist that are options if the patient is really hesitant or reluctant to go and have a colonoscopy right off the bat. So after hearing her options, Mrs. Klein decided to go forward with doing the Cologuard test, which is the DNA screening test for colon cancer. So it was easy. We just order it from the office and it comes right to the patient's house. And she did it really quickly, sent it off.
Got the Cologuard test in the mail, and I thought, this is great, I'm gonna do this, it's gonna be so easy. Read all the instructions, and it was easy.
While colonoscopy is the gold standard for detecting colorectal cancer, patients may hesitate to take that step right away, preferring to take an at-home, stool-based screening test. These tests look for abnormal sections of DNA or for hidden blood in the stool, which can be early signs of polyps or colorectal cancer. While these tests don't allow your doctor to see your colon or allow for polyps to be removed, they can provide important information to your healthcare provider and determine whether or not you need a colonoscopy.
So one of the problems with colon cancer is that it can be totally asymptomatic, which is why we screen. With colon cancer being such a horrible disease, a lot of my patients just want to sit on the idea of screening for it, right? Don't sit on colon cancer. But colonoscopy being the gold standard, it's very important that we get direct visualization, we sample any polyps that are there. But there are ways to continue screening even if you're not ready to make that step. And it's important to have that conversation with your primary care physician so that you can go through that shared decision-making process of what's best for you, because not screening is not an option. So we have Cologuard, which is a multi-targeted DNA study that can test your stool, recommended every 3 years or so. That has a pretty good sensitivity for looking for precancerous lesions, which would result in you having a colonoscopy to kind of track that down. There are also some immunochemical tests, some stool blood samples, things that you can do yearly to give us some sense of what's going on. Colon cancer has risen in the younger population, which is one of the reasons the United States Preventative Task Force has reduced the screening age from 50 years old to 45 years old. There is a significant amount of youth that are dealing with colon cancer and don't recognize that they're being affected by it. There are a lot of risk factors for colon cancer. Some of them we can modify: diet, exercise, decreasing alcohol use, decreasing our weight outside of the obesity category, and some that are not modifiable. We notice that, certain African American populations are at higher risk for more aggressive cancer. Having a first-degree family member with a history of colon cancer, all of these things play a role in your risk factor for colon cancer. If you have any reservations about it at all, ask the questions that are preventing you from these life-saving screenings. And don't be afraid to take the next step of choosing a screening option that's best for you, because it could save your life. And it could pay off down the line if your offspring or the next generation is aware that there's a family history of this and they can get screened earlier. So I would always encourage my patients to find a primary care physician, establish that relationship, and don't sit on colon cancer.
But what if the Cologuard or FIT test shows an abnormal result? The next step is a colonoscopy, which allows your doctor to see and examine the entire length of your colon. If a polyp is discovered, your doctor will remove it and send it to pathology for testing to determine if the polyp is cancerous.
So we received the results from her test, and unfortunately they were abnormal. So we reached out to the patient, told her the results, and we had told her before that if it was positive, we would send her to the specialist.
Dr. Ainsley's office called me right away and said that it came back, it was a problem, and that they needed to get me in as soon as possible to see Dr. Converse. And of course, you're gasping on the phone like, oh my, no, don't. They reassured me that this doesn't necessarily mean that it could be cancer. It just means that there's something that showed up that they need to do a colonoscopy procedure to screen for certain. So that happened really fast. I got in to see Dr. Converse, got all the instructions.
Mrs. Klein was referred to us from her primary doctor due to a positive stool DNA test, or Cologuard. That's what brought her to us to pursue a colonoscopy. All patients with a positive Cologuard should be followed up with a colonoscopy. The Cologuard looks for DNA that is sloughed off of lesions in the colon, be it adenomatous polyps or cancers. The FIT test is looking for the presence of blood. It is developed in a way that it tries to only detect human blood, not blood that you would ingest from eating a steak or other sources. So an abnormal stool DNA or FIT test, they have false positives as well as false negatives. Having a positive test, again, should be followed up with a colonoscopy, but doesn't always mean that you have cancer.
The prep was not that bad at all. In fact, it's, I guess they've perfected that over the years, Used to hear horror stories, but not so bad at all. It really isn't. And it's just a colon cleanse.
We are Riverside Strong.
So you've been scheduled for a colonoscopy. While no one likes prepping for a colonoscopy, it's what allows your doctor to get a good look at your entire colon and remove polyps, the growths that can become cancerous. Let's take a look at what a good prep involves. You might be surprised at how easy it is.
The colonoscopy is the gold standard for colorectal cancer prevention. This is the only test that can prevent colon cancer. It can identify abnormal growths in the colon that can be removed, thus preventing colon cancer. Hardest part about doing a colonoscopy is the day before. You can be on a clear liquid diet for the whole day, which can be challenging itself. But in the evening, you're going to start a very strong laxative that's going to make you go to the bathroom a lot. And that is important because the cleaner you are, the better look we get the next day. So it's very important that you follow all the directions. So the day of the procedure, you would come in, we give you medicine through an IV, make you sleepy and comfortable, take a little tube with the camera, go in through your bottom, take a look at the entire large intestine, identify these precancerous lesions and remove them. So once those polyps are removed, those are sent to a pathologist to review under a microscope so we can identify what type of polyp it is. There are different types of polyps that have different degrees of risk for colon cancer. So depending on what type it is, we'll decide when the next colonoscopy would be. One of the main risk factors for colon cancer are polyps. So if you are just predisposed to developing polyps, you're more likely to develop more. And that risk of developing polyps increases with every decade. So it's important that you keep the intervals that are recommended so that these polyps could be identified early and removed safely. Right-sided colon cancer is more common in women, and that's through a different type of polyp called serrated adenomas that tend to be flatter and harder to see. So that's why it's very important that women get colonoscopies on time. Colon cancer in general is about 25% higher in men than women, and African Americans have a 20% higher risk of developing colon cancer than Caucasian populations. So even before we used to recommend starting screening at age 45 for African Americans, well, now we would recommend that for everyone.
People have the misconception nowadays that colonoscopy is this barbaric thing. And sure, the preparation is no fun. I can attest to that. I had a colonoscopy last week. You can get through the preparation and get out of there with a great bill of health and probably won't need to come back for several years.
Choosing a healthcare partner is an important decision. At Riverside, we understand that. We also understand what you want and need. Exceptional care, comprehensive services, access to a network of expertly trained medical providers, specialists, and care teams when and where you need it. And most importantly, a team dedicated to partnering with you throughout your journey of lifelong health and wellness. We say partner because at Riverside, we are healthier together. We are Riverside Strong.
In many cases, a colonoscopy will reveal no polyps at all or benign polyps that are easily removed. But what if you have a polyp that's cancerous? What's the next step? What are the treatment options?
Mrs. Klein, when she presented for her colonoscopy, had several polyps, a larger one that was lower down in the rectal area that returned positive when we removed it for invasive adenocarcinoma. The next step is to tell the patient. You let her know what it was that we find and outline for her, where do we go from here? You know, how are we going to help her get the appropriate studies, the appropriate referrals? So we set her up for specific blood tests, set her up for CAT scanning, and referred her to our colorectal surgeon, Dr. Billings.
So Mrs. Klein underwent what's called a Cologuard test, which is just a stool sample test. It looks for abnormal DNA, and it's very sensitive at finding cancers, not very good at finding polyps. Her test was positive. That didn't define for sure that she had a cancer, but it made us go look for one.
Oh, I was having lunch with my husband when Dr. Billings called me personally and told me that I would require surgery, but it would not require a coloscopy. I really heard nothing more after that. I wish I had handed the phone to my husband, because then we took our lunch to go and we sat in the car for a minute and kind of recollected our thoughts. And then I had an opportunity to talk to him again, and him explain, you know, that it's a resection of your colon. We'll take out the bad and we'll reattach the good, and we'll know more from there. At that point, we didn't know if I would have to have chemo or radiation, but I did not. I had so many questions on my mind at that time. My husband, all he wanted to do is just tell the girls. I'm like, no, we're not going to tell the girls because we don't have enough information. We don't know what we're doing, what the next step is. We don't know what to expect just yet. Let's wait. Well, he couldn't wait. They were all so supportive. We all had a positive attitude. We've caught it, you know.
Once the patient sees me and they have a diagnosis of colon cancer, the first thing we do is, of course, look at their history and talk to the family history, because some cancers are hereditary. And we did CAT scans to look to make sure the cancer hadn't spread. All of our CAT scans looked good. And we talked to her about surgery. Being that this is an invasive cancer, there's no real other good treatment option other than surgery. And so for her, we did a laparoscopic or minimally invasive surgery where we took out that part of her colon and we put the colon back together. In her final pathology, then we send that to the pathologist. He's going to look at what we call the primary tumor, which is the tumor in the colon, and then look at all the lymph nodes. All of her lymph nodes were negative. The tumor was early. It was just starting to invade, so it was a stage 1 colon cancer. Stage 1 colon cancer is obviously the earliest stage of a cancer.
Mrs. Klein had a very successful operation with Dr. Billings, and we recommended that she return in a year for a repeat colonoscopy, not so much to look for the cancer that was removed, but to look for new lesions that can pop up. She's at higher risk for new polyps, and we want to get them when they're really small and they don't develop into the issue that she had.
At Riverside, we are here to be your healthcare partner throughout your life. We are here for you, for an annual wellness visit, to help you manage your health conditions, or to figure out your next steps when unexpected situations arise. We are here when and where you need us, even online, offering easy, secure access to your health records, appointment scheduling, video visits, and more. It all starts with choosing Riverside as your healthcare partner. Call or visit us online today. We're Riverside Strong.
Colorectal cancer can sometimes require additional treatment, including radiation and chemotherapy. The specialists and care team at Riverside Cancer Care Network work together to customize a treatment plan tailored to each patient's needs.
Radiation for colon cancer is only used for rectal cancer, and generally we use that before surgery. And the reason that we use it before surgery is it will decrease the size of the tumor, and which will improve our odds of removing it completely, probably improve our odds of being able to put them back together so they don't have a colostomy bag, and it definitely decreases the long-term recurrence rate, so it improves survival. Chemotherapy is generally based on the lymph nodes. When we take out the tumor and the lymph nodes, if the lymph nodes are all negative, we generally do not give chemotherapy. In rare instances we will, but we generally don't. If the lymph nodes are positive, that means that the cancer has gotten through the wall of the colon and is trying to become more systemic, and that's when we would use chemotherapy. The chemotherapy that we use today for colon cancer is very effective, and the side effects are very well tolerated. I've had gentlemen in his 70s with stage 4 colon cancer on chemotherapy that was still working full-time because it's what he loved to do. Our options for treating what would be considered terminal colon cancer or stage 4 colon cancer have expanded, and our survival has expanded as well. And now we treat it almost like a chronic illness. One of the great things at Riverside is that we have a whole team of people working. And so that includes the gastroenterologist, the surgeon, the medical and radiation oncologist, and the radiologist. And what we do routinely is we'll meet in the morning and we'll discuss cases regarding the radiology findings, the pathology findings, and we'll come up with a treatment plan that everybody can agree on. And I think it's a better way to approach these kinds of cancers because it allows a greater breadth of knowledge. Every cancer comes from a polyp. Probably not every polyp will turn into a cancer, but if we remove them ahead of time, we probably prevent a cancer from occurring down the road. And studies have shown that. They've done studies where they looked at people that had adequate colonoscopies by good endoscopists, and their chance of dying of colon cancer is much less. If you have colonoscopies as recommended, so at the recommended times, these starting at age 45, every 10 years if it's normal, or sooner if they find polyps, then we expect to find polyps that are smaller, and the chances are that if a cancer had developed in a polyp, it'll be earlier. Statistically, it's shown that your chance of dying of colon cancer is less if you have good colonoscopies done by good endoscopists. And at Riverside, our endoscopists are well above the national average for finding polyps, which is a key marker as to their quality.
We're Riverside Strong.
Having colorectal cancer is largely preventable if you get screened on time and follow your healthcare provider's guidance about when you should repeat your screening. As a colorectal cancer survivor, Ms. Klein has increased her commitment to taking care of herself and making sure her friends and family get screened too.
I had absolutely no signs or symptoms, nothing unusual about anything. Everything was flowing fine. No indication, and no family history. So, there again, I'm a busy person. I don't have time for a colonoscopy. I've got no time for the prep. That was my fear, I guess, the prep, because you've got to be close to home. Really, you do. But it's okay. It's just a couple of days, and then you're done. My experience with colon cancer has really made me more aware of my body, everything. Because, when you have cancer, and then thankfully, I'm so blessed I didn't have to have chemo or radiation. I still had questions like, are you sure? Dr. Miller, are you sure? And he kept reassuring me there's nothing there. I'm getting my regular CAT scans and my screenings, my regular colonoscopy screenings, and it's still, this little on your shoulder, you had it once, you could get it again, you could come up somewhere else. And I do, I think about that. I try not to, I don't live in fear, I trust the Lord, but it just is something that you live with once you've had cancer once. You can't help but think that it could come back somewhere else. So that's another reason why it's so important to keep your regular screenings, do your regular doctor appointments. There's so much that can be detected just by being aware and having your test and your appointments. You only have one body. It's your temple. What you do with it, what you put into it, how you treat it, exercise, eat right. I thought I was doing all those things, but you still need that little extra help with your screenings that can be done that tell you what's really going on inside that you wouldn't have known otherwise, because everybody thinks we're okay, we're doing all the right things, but get the screening, get the test. It's not that big a deal. It's not that difficult.
The role of primary care is to help patients get the appropriate screenings they need at the appropriate intervals for things like cancer. When we focus on early detection, the point would be to do the screening test before the patient has symptoms and catch the problem or the cancer early, and so that we're able to treat it aggressively from the get-go, and the patient will have better outcomes at that time.
Colorectal cancer can develop anywhere in the colon, and a lot of people are under the assumption that, well, I'm going to notice a change in my bowel habits, I'm going to see blood in my stool. And that may be the case if the lesion is in the rectum or lower in the left colon sigmoid area. But you're just as much to have the colon lesion be in the far side of the colon, where any bleeding will get mixed with stool and you won't notice it. So the importance of getting that screening test at age 45 can't be stressed.
It's really rewarding to be able to see a patient and talk to them about something as simple as a screening routine test, and the patient, doesn't think much of it, but then goes on to have the test, and unfortunately they find something. But it's rewarding to be able to be on the back end with a patient and help them through that process and see them, years to come every year, and they're doing great. And it's nice to be able to refer them to the doctors within the same system, and we're able to keep the continuity of care and be preventive and find things early. I think the patients really respect that and love that, and they love the relationship they have with their primary care physician as a result of those sort of things.
I have the most amazing team of doctors, from Dr. Ainsley to Dr. Converse to Dr. Billings to Dr. Miller. They are just such a great team. Looking back, if I had not met my friend at that Jeep event on that day, at that time, at that point in my life, that was my moment. That was my light bulb moment that, look what she's going through. When you have kids, it's mom last, kids first, all their events, you don't want to miss that. I can't do it this weekend because you've got a cheer competition. I can't do it next weekend because we've got a family outing planned. Those life got in the way of me doing the right thing. Don't let life get in the way and keep you so busy with the things that you enjoy that you forget to take care of your body. When you think about colon cancer and the exam or the test or the screen, it's just, all this, it's right here before us, we can see, but things inside your body, you can't see unless you have that extra help from a screening and your doctor. Because the waiting is the hard part, waiting and then when you find out that it's really not that bad, it's not that big a deal. It's a big deal if you don't get screened and then you find out you could have prevented something that would have given you a better quality of life. I need to tell my story every opportunity I can get and not be afraid to share it and hope that it inspires others to do the right thing. Get your screening, get your tests. You can have a better outcome for your future, for your health, for your family, for your grandchildren, for your children.
With screening, colorectal cancer is one of the most easily detected and preventable types of cancer. Begin screening at age 45 or earlier if you have personal risk factors. You have choices in how to screen for colorectal cancer. Screening is important no matter which screening method you choose. Knowing your risk factors, knowing your options, and getting screened could save your life. That completes this episode of Riverside Strong. Talk to your primary care provider about your risk for colorectal cancer. For more information on any of the Riverside Health System services and providers, please visit riversideonline.com. Want to see past episodes? Catch them all on yourview.com. Until next time, stay healthy and stay informed with Riverside Strong.
We're Riverside Strong.